Good afternoon, and thank you for joining One Group's informational update. My name is Allison Dunn, and we're glad you could join us for our fifth update on the coronavirus and various business-related impacts. This week, our focus is on helping employers start actually planning for the return to work, and we will also provide pertinent updates as well. We have several of our experts with us today. We have Paul Kader, Vice President of Risk Management Services, Kelly Goodsell, Vice President of Claim Risk Management, Dennis Ast, Senior Account Executive, Cyber Risk Specialist, Casey Cohn, Senior Human Resources Consultant, and Todd Hoffman, Senior Bank Liaison. We will be discussing updates to address our clients' frequently asked questions in the areas of risk management, claims and coverage, including cyber, human resources, and small business relief, specifically the Paycheck Protection Program. We do have to include our disclaimer. This is for informational and educational use only. Nothing in the discussion should be considered to be legal advice. Please consult with the appropriate attorney or advisor before addressing any situation raised in this discussion. Back on October 16th, which seems like forever ago, the White House issued Opening Up America Again. This included federal guidelines to reopen the U.S. economy through a three-phased approach. State and local governments have already begun, as you all know, to create their own frameworks to gradually lift stay-at-home orders with important differences, certainly in each locality. So in turn, employers are now starting to and should be taking steps to prepare for reopening their physical workplaces and returning employees to work in offices and other facilities as it's appropriate to do so. So for today, we've structured this discussion to cover key updates and areas that our clients have been asking about. We've also requested that participants share any questions with us before the discussion. And because we have so many participants on the call, we have muted everyone, but we did ask for your questions prior and certainly we're available after. Please feel free to reach out with any specific questions that we did not address. We also have a lot that we'll be going over today. So we have posted all of the content. Everything that all of our experts will be talking about has been posted to our website, which is onegroup.com. We have a COVID-19 section on the main page that includes all of the information. And I will mention that there are a lot of great resources we've posted as well. So not just content we're talking about, but all the references to the different materials that we're going to speak about today are all posted to our website as well. So with that, we'll turn the conversation to risk management and Paul Kader. Paul has been serving as One Group's risk management subject matter expert quite a bit, both internally and externally to our clients. So Paul, we'll turn it over to you.
Alrighty, thanks very much, Allison. And welcome back, everybody. For those who are returning, welcome in. For those who are in for the first time, one of the key things that I've been getting questions on over the past week and a half, and it's directly related to what's going on in the news every day. I'm sure everybody's watching the governor's presentations and the president's presentations, is what happens as we start moving back into our workplaces. And I like to think of it as preparing for reentry. We've been on this wild journey out into the unknown, so to speak, and now we're trying to get back home. And just like in spaceflight, this reentry can be a little bumpy as we're coming in, and we want to make sure that we try to plan for it and have a smoother reentry into the workplace as we can. As we start thinking about reentry or getting back to work, we have to look at it and really delve into it from a strategic standpoint. We have to consider what's gone on over the course of just the past few weeks, a couple months, maybe quarter of a year, and think of the changes that have taken place in our economy, our society, and our workplace. And we have to consider when we start going back to work, how do we do this? Some of us have been shut down for a while. Some of us have not been shut down. We've been going full bore. And there's those in the healthcare industry that have been faced with something that was beyond what any of us anticipated. So now as we start trying to get back to some semblance of normal, whatever that might be, we have to think about what that includes. So if we can go to the next slide. Thank you. As we start working on that strategy, just for the sake of trying to take a very big thing and make it reasonable and understandable and manageable, I've taken it and we've broken it down, and Allison and I have talked, and we've broken it down into these 5 things: process, structure, planning and implementation, resources, and then human resource considerations, because as we all know, that's such an important piece of this whole process. Next slide, please. So when we start looking at this, I'm going to take that first element of process. We recognize that this whole situation that we're in right now has changed on a day-to-day, week-to-week basis. As we start moving back into the workplace, we got to think back just to March 15th, which wasn't that long ago, and where your organization was. That was prior to any of the close down orders or anything along those lines. March 27th, when the first close downs really hit and we started changing how we do business. Think about how you're doing business today, and let's start thinking about that May date, whether it's May 15th or if it gets pushed out to May 30th or 31st. Think of what we're going to have to do in order to start moving things back inside. We have to recognize that this whole return to work process, this whole getting back to work process is not going to be, okay, where we are today, and then tomorrow we go back to what was normal back on January 1st, because it's not going to be. It's going to be phased in. You've seen the governor's talks as far as maybe phasing in by regions, phasing in within the regions by industries. I'm not sure how many of you are going to drive down to Georgia to get your tattoos, but now that that's available to you, you might want to do that. I'm not quite sure why tattoo parlors have become the essential business first to be back in full business. But anyway, that's neither here nor there. But there's different things that are happening in this transition process, and they're going to keep happening like that. So we have to recognize that the current reality today that we're working in today, and some of you might be working in that reality, is going to change come May 15th or May 31st. It's going to change again as we move down the road and we start getting better therapeutics and eventually vaccines and things like that. Our reality at the time is going to change then to maybe expand more openly, or as Dr. Fauci and some of the others have been saying, maybe in the fall we're faced with another serious situation of a combination of COVID and the common flu. And maybe we have to go backwards a little bit at that time. How do we respond to that? So we have to recognize that this is going to be a phased input back into our organizations, and we have to deal with that. And ultimately, when we look 18 months down the road, 24 months down the road, and we do have vaccines, and we do have therapeutics, and we can manage this situation, what is your organization going to look like at that time, due to the fact that it's been through all this? And in a lot of cases, there are going to be changes that are going to demand things from an infection control standpoint and a hygiene standpoint, changes like that. But I think you're probably recognizing, as we have, and as many organizations have, that from this whole chaotic situation, there may be opportunities out there too to make changes to our organization that'll actually improve how we do business. So as we look into this getting back to work, don't think of it as today and tomorrow, but think of it as today, tomorrow, the next day, the next month, and the next year. Next slide, please. When we start looking at how we're going to get there, how we're going to manage that process and change and adapt, we have to look at structure. Like anything else in an organization, it gets done through the structure of our management team. It can't be done by one person unless that person is a dynamo, but it's usually done by a group of people with different disciplines that come together with ideas and capabilities to build systems, programs, and whatnot to get something done. So what I always look at is, I'm a minimalist. I say, okay, at any given time, keep as few people involved as possible. So you might want to start with a steering group, which might be your executive team or key disciplinary people within your organization that get together and look at the strategy of where we're going to go with this in the next phase, in this next coming phase, and maybe the phase after that. They may look at things like the impact on your business. has it gone down? How do you regain market share? How do you regain productivity? Critical business needs. We're all going to be looking at where do I get that next batch of masks to use within my organization? Things like that. Obstacles to the business. You know, maybe your suppliers aren't available at this time. Maybe you may have to adapt to that. Opportunities to change or improve business practices. How many of you have people working at home now that you never thought you'd have working at home, but you're finding out that, oh, we can have productivity from that standpoint? How does that change what's going on? We also look at federal and local guidelines, which are changing minute by minute, practically. And we have to respond to changes from outside the organization. Maybe your suppliers aren't able to provide you things, or maybe your marketplace is going to change. So from a strategic standpoint, you have to look at all those things and consider how those things are going to impact your return into this workplace, your reentry into the real world here. And as we start doing that and we get our strategy together, then we can start thinking about who in my organization do I need to make this happen. And that's where we jump from the strategic standpoint and the structure into the tactical standpoint and structure. So you want to develop a back-to-work coordination team or a tactical team of some kind, and that'll involve your HR managers, your facilities people, your operations people, your engineers, whoever needs to have a role in this and develop changes or programs or protocols that allow you to get back to work. And using the strategy that you've devised, get with these people to develop the implementation plans of how we're going to make it happen. Next slide, please. So if we move from the strategy side into the tactical side of planning and implementation with your back-to-work coordination team, you're going to want that implementation team to be involved in each phase of the movement back into the work. So they'll be devising programs and protocols for today's current reality as you start bringing people back. They're going to be involved as restrictions maybe loosen, and you can bring more people back or increase production or shrink social distancing or whatever the case might be there. And they're going to be involved later down the road if there's another second wave that we're possibly looking at, or as things start opening up even further. So you're going to want that team, that tactical team, to be able to adapt and respond to the changes in your economy. Some of the things that they'll be looking at, and this is by no means an exhaustive list, and we're going to provide you with a little more information through the website for more areas to look at. But some of the things we look at is regulatory changes and keeping up with what's going on. There's going to be a lot of things happening out there from a regulatory standpoint and a legal standpoint that we're going to have to deal with as we move on in this new world. Production changes as far as scheduling, shifts, days, hours, whatever the case might be. Right now, as you bring people in and you're forced to maintain social distancing, you may have to split shifts, have 2 shifts in the day, split workers working 2 days a week at home, while another group of workers is coming in 3 days a week into the office, or vice versa, and shifting that. So you'll be making changes to address those legal requirements that you're under. Infection control, hygiene, testing, reporting, distancing, all those things are critical now. If you're going to come back to work, you have to remember that COVID is still out there. And you look at the numbers in New York State as far as hospitalizations, we all see that, yeah, I think we're past the peak and we're coming down the other side, but you look at the actual numbers of people still being hospitalized for this disease. They're staggering. So until we get down to single-digit numbers in any given area, then you can't really rest on your laurels. So training on new policies, when you're bringing somebody in and you're changing the hygiene protocols, they have to be trained before they come in, when they walk in the door, and then refreshed periodically. Communication, which is critical, and I think Allison's going to talk a little more on that in a few minutes. Facility access to not just your employees, but to vendors, contractors, visitors, whoever might be coming into your business. How are you going to handle that? Are you going to restrict and say, nope, no visitors until such and next phase 2? Are you going to say, okay, if a visitor comes in, they must be wearing a mask, they must go through a hygiene station before they come in, they must be interviewed as far as if they've had any symptoms of COVID? How are you going to handle that? And then what are you going to do with the data that you might generate from that? Plant layout. There's a concept out there by one organization called the 6-foot office, and it is a physical discussion on how do we maintain social distancing throughout an office environment when people tend to congregate at printers and computers and coffee machines and things like that. So how are we going to lay out our office, whether it's traffic flow through the office, whether it's desk space, whether it's partitions, whatever the case might be? How are we going to respond to incidents where there's symptoms? You know, keep in mind, this thing's still out there. So you're going to have people that generate symptoms that might or might not be COVID-19 related. How do you deal with those things? Or you might have situations where family members of your employees turn positive, result in positive tests, and now you've got a quarantine and things like that. All things that you'll have to deal with. Supplies, work locations, and a critical point is how do we monitor all this stuff that's going on? So it might be a responsibility within that tactical team to track certain performance measures to see how we're doing. You know, are people wearing their masks? Are we having success with visitors coming into the building? Where are we falling down so that we can adapt, change, or modify our program in some way? And there's a whole bunch of different ones out there too. One of the documents or one of the links we'll have on our website goes back to the Lear Corporation and their plan on how to implement a return to work program. And it's highly detailed, extremely extensive and comprehensive. Might be too much for the normal companies that we're working with here, but you can definitely go in there and pick and choose and take a look at how they're dealing with things. I recommend that you go out there and jump onto the Lear site and take a look at their plan. But there's a lot of different materials out there. We'll keep looking out there and see what we can find so we don't have to reinvent the wheel on everything. But as you can see, there's a lot of different things that we have to consider when we're talking about returning to our workplaces and getting set for reentry into our new world of economy. So with that, I'll turn it back over to Allison to talk about human resource considerations in this realm, which are a whole nother world. So Allison, if you want to take it away there.
Great, thank you, Paul. And that was so much information, very helpful. I think one of the key things you talked about was really getting that team together, that steering committee or that back to work implementation team. And that's what where a lot of this will start. So thank you for all that information. Moving into some of the specifics with HR and some considerations to think about when you're developing your plan for your employees coming back to work. Step one is really communications, and it goes back to that committee, gathering the right people who have the right knowledge and expertise about different parts of your business and how the return to work will impact each area. I think it's really important to get that team meeting regularly and starting to work with that group to prioritize and set the plan for what things will look like with the employees. Certainly, we want to make sure as part of that group that you're looking at the employees and the fact that they will have fear and they're going to have anxiety about returning to work. There's going to be a lot of misinformation out there, rumors, that type of thing. So it's really important to develop your communication strategy and then execute that. So you have to expect that many employees are going to be concerned about coming back to work, the possibility of infection. So it's so important to be transparent about what you as the employer are doing and how important it is to you to make sure that your employees come back to a safe environment and that they will stay safe and that you're doing everything possible to create that space. So we think it's very important to develop that group of people and get that communication plan going. Part of the communication plan needs to include how you're going to post and distribute information on how to prevent the coronavirus. So as Paul just mentioned, when people do start coming back to work, there's still that risk. There's absolutely that risk of exposure on an ongoing basis. So we think it's very important to make sure that you're using different materials to post throughout the workplace to continually remind people about proper hand washing, avoiding touching their eyes, nose, mouth, etc. All those things that have been ingrained in us very much so over the past many weeks. Reminders of those are going to be really important. So communicating with your employees about your plan and the types of things you're doing to keep the workplace safe is really important, as well as those visual reminders for them. We've also been working on putting together rules of engagement and recommending that for clients when they do have their employees come back to work. And what does that mean? When people do come back, there are going to be new expectations for how they interact with customers, with clients, with vendors, with each other, with our colleagues. So it's going to be important to have expectations for the employees. You know, what is expected for them when they use a conference room or when they travel to a client site or have a guest. All of these types of things need to be considered, and they're going to be different based upon your environment and what type of work you're in. But I think it's important, we think it's important for there to be very clear expectations about what employees should be doing, are required to do, and then we hold them accountable for that. It's also going to be important to distribute information so that employees know when they do come back, how, to whom, when they should report any sort of infection or possible exposure to the virus. Another very important piece of this. It'll be important also to have employers establish a travel policy. So we want to make sure that the employees know when they can travel, when you've opened things up for them to go visit with clients, what types of travel restrictions do exist. And we always reference the CDC's health notices for this, for the latest on travel restrictions and recommendations for avoiding transmission. But I think that's going to be really important for employers to look at as far as what the policy on travel will be. Certainly consider limiting non-essential travel for business to affected areas or to areas of increased exposure or risk, and really establish the proper protocol for travel. So another, again, depending on what type of industry you're in, that may or may not be a big issue, but for those who do have employees who travel, certainly something to develop as you look at people coming back to work. And then also, I think it'll be important to advise employees to check themselves for symptoms, and when they're traveling, when they start travel, and to notify human resources, and certainly stay home if they are sick. And that'll be a constant reminder for people. I know that many employees will be anxious to get back to work, and we'll need to keep reminding them if they are sick, they need to stay home, and certainly remind them when they do travel, they should try to avoid contact with sick people and follow those CDC guidelines that we're also familiar with. Also, from an HR standpoint, it'll be important to establish guidelines for reporting and restricting travel after someone has been exposed. So consider requiring your employees to report any travel to affected areas or exposure to the coronavirus. Also consider asking employees if they return from areas of significant exposure or have had contact with a contagious person to refrain from coming into the workplace for an established period of time, typically 14 days, to protect the employees in the workplace from a potential exposure. Again, all of this is protecting the employees who are coming into the office. And then it'll be important from an HR perspective to look at leave options. So each employer should really take a look at their HR policies and make sure that their policies and practices are consistent with public health recommendations and existing state and federal workplace laws. And we certainly know there have been some changes there. So it'll be very important to look at your handbooks, look at your policies, practices, and make sure that's all consistent. It's also important to make sure that your management team understands the different types of leave to a degree. Certainly human resources can be the experts on that, but depending on the size of your organization, it will be important for the management team to really understand how these work at a high level so they can help employees understand that. And it's also important for people to know how to respond to worst case scenarios. So we talk about having this team that guides people on the return to work. It's also important that this team considers those worst case scenarios. What do we do if someone reports an infection? Or what do we do if there's some sort of widespread infection in the workplace? Those are things we want to certainly recommend that you prepare for so that you can have a plan for that. And really, it's important too for the management team to understand the company's desired approach with respect to the leave options and how, yes, we have the certain laws that we're required to follow, but then how do those play into your policies and making sure that it's being administered consistently throughout your organization? Certainly, it's important to understand your employees' rights. That goes without saying, and their obligations under the ADA and state laws, OSHA, et cetera. But certainly, we would advise you to take a look, consider revising any employee policies that may come into play relating to leaves for coronavirus. And again, make sure that they're following any of the new requirements. We think it's also important to openly communicate to the employees any of the new policies. So that is certainly an important piece of the communication as well. And then just to touch on the last area for consideration, and there are many, and again, all of the detail that I've spoken to, we've posted everything to our website. The last thing I'll just mention, and Paul alluded to this, but certainly looking at remote options and realities. I think many employers are finding that some employees can work remotely and they are extremely effective and they are very productive. And so I think it's important to look at that and how that's impacted your work, your operations, and see if there are potentials to open up the work from home option if it in fact does work, or certainly perhaps learning some things that might adjust if you already have that program in place, maybe adjust it for going forward. So with this, we would recommend that you look at whether you would be able to establish any policies or practices such as working remotely, which would help with the physical distancing of employees. And certainly that would be something to look at depending on how your office is set up and if you have the ability to have that social distancing in place. Maybe that's a temporary type of situation that you consider. But certainly when you're looking at the remote options, be mindful of the precedent this could set for work from home requests and any future requests for that accommodation. Be sure to balance the risk and benefits before deciding whether to adopt such a policy. And certainly we would recommend that you ensure that you have all the IT infrastructure, of course, to support the multiple employees working from home. And you've already probably worked through that now, but if that's going to be an ongoing type of situation that you offer to your employees, making sure that's all in place is important. And if you are going to be allowing more remote work to minimize the workplace exposure risk, clearly communicate that that there's a process for that and what your expectations are for that work from home. And then lastly, I will say about the remote work, I think it's just important that if you should certainly consider that even if there is the time frame that non-essential employers are able to have their employees come back to work, anticipate that you may have more requests depending on what's happening with school closings, daycares, et cetera. There certainly may be more requests for that type of relaxed approach or that work from home. So I think it's important to navigate through that and have a plan for those types of requests. So those are some of the considerations as you do have your employees come back to work and phase that in, some of the HR considerations. While we're on the topic of HR, we also have some HR updates that we wanted to share with you today. So with that, I will turn things over to Casey Cohn, and she has been very busy advising our clients relating to a lot of different HR areas, specifically new legislation, and answering their questions. So with that, we will turn it over to Casey.
Thanks so much, Allison. Hi, everyone. Thank you for joining us. I wanted to spend the next few minutes and talk about some updates and information based on some of the questions that we've been receiving. To start, I wanted to talk a little bit about an announcement that the Department of Homeland Security made, and actually made a few weeks ago, with regards to flexibility and requirements related to the Form I-9. So the form that every new employee is required to complete to show that they're authorized to work in the United States. But essentially, and this is only relaxed for employers and workplaces that are operating completely remotely, so there's no other exceptions to this. But if you find yourself where you are operating completely remotely, the department, the DHS has said that the requirement to physically examine those documents that an employee would provide is relaxed slightly given the current environment. So there's very specific steps an employer has to follow in this situation. Essentially, the employer still has to inspect the documents remotely. However, this can be done over video link, fax, or email. And then they need to obtain and inspect and retain those copies of the documents within 3 business days for the purposes of completing the employer section. Once normal operations resume, all employees who were onboarded using this method must provide their documents to their employer within 3 business days for in-person verification. And once that is done, the employer has to make certain notes in the verification section that the documents were physically examined. The reason that there was a delay for this was due to COVID-19 and other instructions provided by the DHS. So Again, this might not apply to everyone, but certainly for those in this situation, I wanted to share that information. These provisions are implemented until May 19th. They're in effect until May 19th, or within 3 business days after the termination of the national emergency, whichever comes first. And again, this only applies to employers and workplaces that are operating completely remotely. If there's anyone physically present at a work location, there's no exceptions to completing the Form I-9 as typically required. For more information, we have posted information to our website on those specific instructions, and also we've created a 1-minute HR email blast that will be sent out on this topic as well within the next few days or so. Moving on, I wanted to spend a little bit of time talking about some other frequently asked questions we received with regards specifically to, what can employers ask employees with regards to symptoms, or what can they require if someone has stayed home and now they're coming back to work. And actually the EEOC posted some revised and additional guidance and technical assistance for employers during this time. There was updates on April 9th and also April 17th. So some of those questions that have been posed and answered are as follows. The first one, how much information may an employer request from an employee who calls in sick in order to protect the rest of its workforce during the COVID-19 pandemic? The answer is during a pandemic, ADA covered employers can ask those employees if they are experiencing symptoms of that pandemic virus. Certainly the information received must be maintained in a confidential manner in compliance with the ADA, but employers during a pandemic can ask if someone is experiencing the symptoms of that virus. Also, when screening employees entering the workplace during this time, can an employer only ask employees about COVID-19 symptoms that the EEOC has identified as examples, or may an employer ask about symptoms identified by public health authorities? The answer to this is, as public health authorities and doctors learn more about COVID-19, certainly the list of associated symptoms may be expanded. As such, employers should rely on the CDC or other public health authorities and reputable medical sources for guidance on those emerging symptoms. Those sources may guide employers in choosing the questions to ask employees in order to determine whether or not that individual would pose a direct threat to the health of the workplace. Additionally, when may an employer take the body temperature of employees during the COVID-19 pandemic? Generally, measuring an employee's body temperature is considered a medical examination. Because the CDC has acknowledged the community spread of COVID-19 and has issued precautions, employers can measure employees' body temperature. However, employers should be aware that some people with COVID-19 do not have a fever. But again, in this current environment that we're in, employers can measure an employee's body temperature. Additionally, does the ADA allow employers to require employees to stay home if they have symptoms of COVID-19? Simple answer, yes. When employees return to work, does the ADA allow employers to require a doctor's note certifying fitness for duty? The answer to this is yes. However, as a practical matter, doctors and other healthcare professionals may be too busy during this time to provide certain documentation. Therefore, new approaches might be necessary, such as reliance on local clinics to provide a form, an email, something of that nature to certify that the individual does not have the pandemic virus. The CDC, OSHA, and the DOL, they all urge employers to be flexible in this regard. Recently, the EEOC recommended that employers be flexible and creative with respect to what is considered acceptable documentation. Another update, as government stay-at-home orders and other restrictions are modified or lifted, how will employers know what steps they can take that's consistent with the ADA to screen employees for COVID-19 when they're coming back to the workplace? The ADA does permit employers to make disability-related inquiries or conduct medical exams if those are job-related and consistent with business necessity. Inquiries in these types of exams meet this standard if it is necessary to exclude employees with a medical condition that would pose a direct threat to those in the workplace, to the safety of those in the workplace. So again, employers will be acting consistent with the ADA as long as their screening is implemented and is consistent with advice from the CDC. So for example, as we talked about taking temperatures, asking questions about symptoms, those types of measures are acceptable for those that are entering the workplace. It is important, though, to apply those policies consistently. So if you are implementing those types of procedures, they should be applied consistently across your workforce. And then lastly, a common question with regards to specifically return to work in this environment. If an employer requires returning workers to wear certain personal protective gear, can an employer grant an accommodation request if an employee needs one? So essentially, an employer certainly can require employees to wear protective gear, for example, masks or gloves coming into the workplace. However, if someone does have a disability need and therefore needs a related reasonable accommodation under the ADA, such as non-latex gloves or a certain gown that can be designed for someone who uses a wheelchair, the employer should discuss that with the individual and provide the modification, presuming it's feasible and not considered an undue hardship. Lastly, just as we talk about and start to think about returning to work, based on some material that I've been reading and some webinars I've been attending, I wanted to mention, and it also goes along with what Allison was saying, but to be prepared with, there could be an increase in not only work from home requests, but potentially leave requests. So for certain employers that might not have had to administer that many leaves under the FFCRA or these, additional enhanced leave requirements, be prepared and be, aware of what the requirements may be. Certainly, employees may request certain leaves now that they might be returning to work, but perhaps they don't have childcare available. So just, again, to be familiar with what those requirements are, know what your obligations are, and just to be prepared in the event you do receive an increase in those types of leave requests. And with that, I will turn it back to Allison.
Casey, thank you so much for all that information. And now we will turn to claims and coverage. We have Kelly Goodsell and Dennis Ast with us this afternoon, and they have certainly worked very closely with our clients and our team internally to navigate through many coverage questions. So Kelly and Dennis.
Great. Good afternoon, everybody. Hope you're all doing well. I'll just give a quick update here with respect to, I'll start with commercial coverages and some of the things and questions that we're still seeing. It's the same questions that we've been seeing since this whole thing has started. Does my policy provide, coverage for business interruption or economic loss? And the majority of the policies, unfortunately, they do not. We are reviewing all of our clients' policies on a daily basis, and we're submitting claims to the appropriate carriers and getting official determinations of coverage on their behalf. We do feel that it's best that we submit the claims proactively. If you've been on any of our previous webinars, you've heard me talk a lot about what is going on at the state level with various bills being proposed to legislation, as well as federal potential regulation coming out that may force the insurance carriers to retroactively provide the BI coverage from the insurance policies. So we continue to monitor that. I wish I had a crystal ball. I think everybody does during this time to really see what is going to happen in this space. But if you have any questions, I would encourage you, and I know a lot of you have already reached out to myself or your one group representative. I'd also like to point out for maybe any folks that have not been on the previous webinars, we do have on our one group webpage, there is a document there. It's titled Navigating the COVID-19 Claim Management Process. So if you'd like to see any additional information on claims and things that you should be thinking of or considering, I'll refer you to that document. I think probably shifting gears a little bit relative to today's topic, when we're going to gradually be bringing our employers back. I think I'd like to also mention we are seeing an uptick in workers' compensation claims being submitted relative to COVID-19. And when I say being submitted, that doesn't necessarily mean that they're being accepted as compensable COVID-19 claims. We are encouraging our clients that if they do have employees within their offices, retail, healthcare, actively working, and they do test positive and they're losing time from work as a result of it, we are encouraging that our clients are reporting those claims to the applicable workers' compensation carrier or third-party claims administrator. They will go through a vigorous investigation. I saw one today, the questions that are being posed and asked, and I think the carriers are really doing a good job in doing their due diligence in really connecting the dots. We don't want to just accept these as workers' compensation, but we also don't want to deny them to those that are entitled to the benefits. So that continues to go on. Shifting a little bit away from COVID-19 workers' compensation claims, because of COVID-19 and everything that's going on in the environment these days, not being able, the delay in getting medical care and treatment and elective surgeries, that also kind of is affecting the prior workers' compensation claims. So some of the questions that I'm seeing from our employers that actually have employers out on workers' compensation is, that their employees cannot get to their doctors for follow-up visits, for injections, for physical therapy, et cetera. So unfortunately, that is going to cause an effect on the cost of an actual workers' compensation with the delay in treatment. It's going to cause a delay in getting employees back to work from workers' compensation, and unfortunately, it's going to increase the overall cost of those claims. So really, with that being said, I would refer you to our website. Check out the Navigating the COVID-19 Claims Management Process. And if you have any questions relative to claims or coverage, please don't hesitate to reach out to One Group and your representative here.
Thank you, Kelly. Dennis, did you want to provide some updates on cyber?
Yeah, absolutely. Great information, Kelly. Thank you. And good afternoon, everyone. So sadly, we're seeing a pretty hefty increase in cyber activity out there and actually cyber claims being presented. It's sad that we're seeing the uptick during this time, right? That the coronavirus is causing enough problems and the cyber criminals are kind of taking advantage of that situation. So the FBI just came out and just indicated that they've seen over a 300% increase over the past month in cyber complaints in their IC3 unit. Just huge. The cyber criminals are opportunistic. They're preying on people's fears and curiosity. Initially, they were creating some fake websites, and now they're shifting away from creating those malicious domains. And the thought process is that now they're going to shift into focusing more on phishing campaigns, ransomware, and other scams that they can actually gain some money on. And in fact, along those lines, Google yesterday came out and identified at least a dozen foreign government-backed groups that are active in cyber attacks, mostly phishing and malware that's occurring right now. So they're really looking and targeting and working on people's fears and curiosity, relative to fake cures, treatments, donations, just general information to take advantage of people. And even on social media sites, a lot of the links that are on those, if you click them, it's taking you to one of these malicious domains. So don't click on those sites. If you want to go to a site, type it into your browser yourself. The FBI specifically is seeing a huge increase in attacks on hospitals and medical research. and it's odd. The thought process here is that they're going in and trying to not so much drop malware or a ransomware attack, but they're going in and trying to find out information. What does that research facility or hospital know in terms of treatment or in terms of vaccines? Can they steal that information and sell it to somebody else? So because of this all going on, the DOJ has said it's going to prioritize and prosecute anybody that's doing a coronavirus scam or fraud, and they are definitely going to actively pursue that. Last time I talked a little bit about Zoom and some of the issues that Zoom was having with Zoom bombing. They came out yesterday with a security update that's hopefully going to eliminate some of that for those that are utilizing Zoom. And we're also seeing obviously an increase out there because of the utilization of the remote workforce. Most companies didn't foresee having the vast majority of their workforce working from home and then having to set up remote networks, VPNs, getting their employees completely set up to work remotely. So just a couple of things from a good cyber hygiene, and we talked about a lot of these last times. Employee training. Just give them the advice. Don't, just think before you click. Don't panic. Just take a deep breath. If you get an email from your manager that says, "Oh my God, I need you to transfer this money now," call somebody on that. Just think about it. Does that seem really reasonable? Have multi-factor authentication and utilize VPNs whenever possible. Use strong passwords and, better yet, passphrases. It's very easy, even in 7, 8, 9, 10 characters, especially if you're only using alpha characters, that a cyber criminal can break that code. So you need to continue to expand your passwords and passphrases. Don't use public Wi-Fi. If you can avoid it at all possible, please don't use it. If you do use it and you can utilize either a personal VPN or a company VPN, that at least offers some protection, but it's still a vulnerable way to access the internet. Secure your mobile devices. A lot of folks now are working from home. They're using their mobile devices. Does your employer that you're now getting your email on your device, do they have the ability to wipe your phone? Is there any type of malware protection on your phone that's there? Because it is a big source of access for cyber criminals. Update and install anti-malware, the best that you can find, next generation, particularly ones now with AI, so that they're learning as they're going through the process and can identify anything outside the norm. Stay current with your patching and updates. All those little notices you get on your phone about an update's available, they make it sound like they're trying to make it easier to use. In most cases, that's not the case. In most cases, they found the security flaw that they're trying to fix. So please update and please do all the patching that you can. Know what your assets are that you have out there. There is a NIST format, NIST, that's available to the public. It is a great framework. So if you need something, use that. Have backups. Test those backups, monitor those backups to make sure somebody hasn't gotten into them, and if possible, air gap them. And what air gap means is that you completely separate it from being connected. It's just sitting on a shelf someplace, not connected to the internet. Nobody can get in there and hack it. That's the best way to protect it. Make sure you got some good vendor management protocols in place. Make sure that those contracts are beneficial to you. And the biggest thing I can say is have a cyber response plan. If you have an incident, or if you think you have an incident, who's your first call going to be? If you have a cyber insurance policy, you should call them first, ask for a breach coach, get it handled that way. If you don't have one, who are you going to call? So know how you're going to handle that if it takes place, and sadly, there's been a lot of them. The quicker you get on them, the more likely you're going to be able to get back up and running quickly. So that's my update. If anyone has any information regarding cyber whatsoever, certainly feel free to reach out to me or your representative, and they can refer to me as well. Thank you.
Thank you. And that is really helpful to hear that. And probably myself personally could hear that weekly, and it's still not enough because I think there's so many different scams out there and whatnot. So those are great reminders. Thank you. Our last part of our webinar today, we're going to turn things over to Todd Hoffman. Todd has been working closely with our clients on small business relief and, as I mentioned before, the Paycheck Protection Program. So we'll be sharing updates with us today. Todd?
Great. Thank you, Allison. Good afternoon to everybody. Today, I'm going to just give you a brief update on the PPP program. As always, if you have specific questions or on details of the program, anything you need to talk about, please feel free to reach out to me through one of your one group contacts, and I'd be happy to talk to you one-on-one. As I'm sure you're all aware, the $349 billion in initial funding for the government's Paycheck Protection Program, which I have a lot of difficulty saying, was depleted over a 2-week period with the available funding running out on April 16th. Most banks stopped taking new applications that same day, which left a very large backlog of applications unfunded. A rough estimate on a national basis is that about 10% of applications were actually funded. So there's a lot out there that weren't. Additionally, on that day, funds for the SBA's Direct Economic Injury Disaster Loan Emergency Program were also depleted. So I guess you'd say $1 billion doesn't go as far as it did in the old days. As you may have seen in the news, the program was not without its controversy. There were accusations made, and a class action lawsuit was filed, or a couple were filed, against 4 large national banks for supposedly not adhering to the first come, first served basis of the rules, and funneling some of those stimulus funds to larger companies so they could get bigger fees. Fortunately, none of those 4 banks have a large market share in Central New York. And I think that our area is primarily served by a great group of regional and community banks who I believe are following the rules and have done a great job providing funding for thousands of local businesses under really extraordinary circumstances. A couple quick examples. An article I saw just this week on Syracuse.com said that one, Central New York bank had issued more government-backed loans to small businesses in a week than it did in all of 2019. One credit union had handled more applications in a 2-week period than they normally do in an entire year. So the banks were under tremendous pressure, handling incredible volume. I know they were working 7 days a week and very long days. And again, my recommendation is when you're dealing with them, just try to be as patient as you can. The good news is that the Senate has passed and the House is set to vote today on a new $484 billion package that will provide $320 billion for the PPP program, $60 billion in new funding for the SBA EIDL program. There's monies that are included, $75 billion for hospitals. There's another $60 billion set aside for smaller banks and community lenders to lend to more disenfranchised communities, I guess I would say. Hopefully, the president will sign that bill tomorrow. So keep an eye on that. It is highly unlikely that any banks will be accepting new applications. They've got that huge backlog of applications from round 1 that will obviously get first priority. Again, my recommendation is to check with your banker to make sure they have your application and all the required supporting documentation. If you haven't made application and you're still interested, give your banker a call and have that conversation, double check to make sure. And again, a reminder that there are more traditional ways of getting debt relief. You can defer principal payments on mortgages and term loans, get a working capital line increase, and talk to your vendors or leasing companies about deferment on those payments. All of those have worked. Another important reminder, if you receive funding, make sure you are closely tracking your expenditures over the critical 8-week period following the loan closing date. You need an accurate accounting of your total payroll costs, your mortgage interest, lease or rent costs, utilities, all which you need in order to qualify for that loan forgiveness, which is a huge part of the program. Definitely been talk about additional federal funding coming in the works, so I'm sure we'll hear about more programs down the road. 2 other quick things I'd like to mention. If you haven't heard about it, one group is sponsoring a Dan Conley tailgate today at 4:00. So look up Dan Conley on Facebook, go to, his Facebook page, or I'm sure there's something on our site. And most importantly, for all those who've been missing sports over the last month or so, the NFL draft starts tonight at 8:00. And for all you Miami Dolphins there, I know that's it's going to be a big night. On that note, Allison, I'll kick it back to you.
Todd, thank you. So lots of important updates, and great that you can bring us, some sports updates as well. So thank you. Thank you to everybody who participated today in our series. We will continue having our series and certainly posting information. I know you've heard us all mention several times, check our website. We don't mean to sound redundant, but there is so much that we cover in our webinars, and we want to make sure it's all accessible to you. So I know we've got it on the screen right now for those of you logged in that way, but if you do go to the COVID-19 Resource Center on our webpage, you'll find all of our previous webinars, the recordings. This one will be recorded. This one is recorded and it will be posted soon as well. So please check our website. And then more than checking the website, feel free to reach out to us. We are here. We know things are very complicated. We know they are not straightforward. And so we are here to help you during this time. And we certainly look forward to helping you and your business prepare to return to work. Thank you. Have a great day.